Hi, everyone. I'm Emily Rubenstein, and I wanted to thank the Ehlers-Danlos Society for inviting me to speak today. When I first started thinking about this talk, I figured I would simply walk you through the steps that it took for me to get a diagnosis. Simple enough. And then I put the details off for weeks, and I couldn't figure out why. And then finally I sat down, and I realized the wrong slides, but I'll keep going. That the reason for that was that my story was so messy that I couldn't just walk you through it. It was a web of lots of different things, and that this is really what it's like to have hypermobile Ehlers-Danlos syndrome. And unfortunately, that's the case for all people with hEDS, that it's not going to be a clear-cut, step-by-step path. The other thing that I kept thinking about was how my specific steps were unique to me. That everyone is going to have their own flavor of their EDS journey, just the same way that they're going to have their own flavor of the presentation of their hEDS. And my flavor was sweetened by the privileges that come from being a white, cis American daughter of a doctor with an Ivy League education, who has relatively decent insurance and knows a lot of medical providers, both socially and professionally, outside of my care team. So a couple of big picture details about my messy web that you'll see in a few minutes once the slides are back up. So I was diagnosed at age 29, which was about a year ago. And although it took so long for me to get my diagnosis, I was just 12 when the first provider mentioned hypermobility to me. I was just 12 years old. So here's my messy web. This is the journey that I took, which don't feel the need to read into it, but as you can see, it wasn't a straight shot. And so I couldn't just walk you through, step by step, everything that I did. So here's the personal stats. And like I said, I was only 12 when I got this mention of hypermobility. Which unfortunately did not turn into a suggestion of looking into hEDS until I was age 28. Between then and my diagnosis, I saw over 22 specialists across over 16 specialties. And even once I got to the providers who knew something about hEDS or HSD, there were at least 3 providers who told me that I either wasn't on the spectrum, I didn't have hEDS, or they really didn't know how to provide what they needed to do for me to get a diagnosis. So this is how my hEDS presented. And as you already can tell from the whiteboard mapping that I showed you, I really did not take a full approach, a full body approach for a long time. It wasn't suggested to me that I do so, and so I was really going to specialist after specialist, referral to referral, test to test, really trying to kind of play whack-a-mole with all of these symptoms. And as you can imagine, trying to follow separate paths for this many symptoms all at once is a little overwhelming and really kind of too much to manage on your own, especially without a quarterback of a provider who can really help you through all of that management. So my turning point was really in January of 2021. I was laying in bed and in severe abdominal pain. And I talked to a couple of doctors who I knew, and they kind of walked me through my own little at-home appendicitis test, which came back negative. And so my boyfriend suggested that I just try to sleep it off. And if I was still in pain, we could go in the morning, because it was really unclear if this was just like the normal abdominal pain that I had often, or if something was actually wrong. So I stood up to get ready for bed, and I almost fell over because of the immense pain that I was in. And I finally realized that I really did need to go to the ER. So I went to the ER. Turns out it was appendicitis. Just like so many things with zebras, there's always an abnormality, and my appendix was just in a slightly different place. And the main thing that I took from this experience was that the attending in the ER scolded me for not coming in earlier, because I hadn't realized that the pain that I was feeling meant that something was truly wrong in my body. I had gotten so desensitized to that level of pain that I could not even tell that I had appendicitis. So that really took me to realizing that I had to take a new approach, to take a whole body approach, and realizing that something was really wrong that wasn't being addressed. And so I talked to my PCP, I saw a functional medicine doctor, I saw a rheumatologist, and none of them were the ones who got me to my path to my hEDS diagnosis, unfortunately. It was a pelvic PT in March of 2021 who suggested that I get genetic testing for EDS. And as you can see, although I finally was on the right path, it still took a year and a half for me to get my diagnosis. And that really points to the fact that the access to care and the number of specialists who we have in this field is not enough for the number of patients who are dealing with hEDS and HSD. I'd like to take just a moment to talk about the importance of diagnosis, because I've heard so many providers talk about how, what's the point of chasing a diagnosis if you don't know if you're going to have access to treatments that are really going to change your life? And I just so disagree with that, because diagnosis, outside of what the medical system thinks that it can provide, provides so much to patients, especially with invisible illnesses. Not only does it provide that validation that no, it's not just in your head, no, you're not making it up, but it also provides you with a community where you can learn tips and tricks, you can, learn different things, and also just not feel alone. Know that there are people who have the same or similar experiences with, and feel a part of something that's larger than yourself. You're not isolated anymore. It's also importantly an illustration to the medical industry that there is a large population of patients who are looking for treatment and are looking for innovation in this area. And as you can tell from my specific journey, provider education is a huge piece of that. So my suggestions for how we can achieve a better diagnostic journey for people in the future is, in addition to that provider experience and that provider knowledge, is to create a clear referral path for suspected cases of hEDS in the medical system. We need clearly identified quarterbacks and paths for people to be able to, once there is a suspected diagnosis, move through the system in a clear way without having to search out so many different things. We also need to increase the access to hEDS specialists across lots of different areas, physical therapists, osteopaths, et cetera. And a big piece of that is including EDS and HSD in medical school curricula to increase the exposure to EDS and HSD early on so that people can choose this as a specialty. So as I wrap, I just want to thank you all for being here, for letting me share my story. And I encourage you all to stay engaged, stay educated, and really think about how the work in your own realm can positively affect the hEDS and HSD patient population. Thank you so much.